Welcome back. This has been one stressful year for just about everyone, but it's been especially challenging for doctors, nurses, and personal support workers. W5's Molly Thomas goes to the front line and finds that the very people whose job is to take care of us are too often struggling to take care of themselves.
Along the frozen shores of Lake Memphremagog in Quebec's eastern townships, the Dion family huddles together. It's a familiar spot they used to visit as kids. Today, they're putting on a brave face to remember a sister, friend, wife, and mother. Karine Dion would have loved this moment in the great outdoors.
My sister was a very kind person, very a big heart. Since she was very young, she wanted to help people.
Geneviève Dion is the baby of the family and the most like her late sister, Karine.
She was the big sister, so she always there to make sure that everyone in the family is okay. Her little sister, me and my other sister, and her brother, so she was a very protective person.
Geneviève looked up to her. Outgoing and energetic, Karine was always the life of the party. A young mother who loved goofing around with her then 7-year-old son, Jacob. She cared for her family the way she did for her patients.
She was a very sensitive person.
Is that why she became a doctor?
Yeah, exactly. She always say that she wants to be a human doctor. And for her, it's like use more time, do some tasks like call family or give a hug, she will give it.
For 6 years, Karine worked in the emergency room here at Granby Hospital, about an hour east of Montreal. But nothing could prepare her for the first wave of COVID.
During the COVID, she always say that it's very tough because I hate medicine now, because it's not the way I want to work.
Karine jumped in to help manage COVID protocols. She was quickly overwhelmed and overworked. It no longer felt personal caring for patients, especially for those in their final moments.
When they see a person who die, they need to rest a little bit, to cry sometimes. And it seemed like you are a weak person if you're doing that. Mm-hmm. When we care about people, we can just follow protocol.
Stress soon turned into fear. Then Karine's colleague got COVID, and she started panicking that she would bring it home to her young son who had asthma.
The most important person in her life was her only son, because she tried to have other baby and she was infertile. So for her, like, she wanted to plan everything to protect her family.
Karine was so on edge, she couldn't rest for days. That led to a sleep-deprived psychosis. She was briefly hospitalized but was determined to return to work. But that first medical leave in March 2020 wouldn't be her last.
When she didn't sleep for a couple of days again, her doctor just asked her to stop again the work.
Take a break.
Yeah, take a break.
Step away from the hospital.
Exactly. And for her, this point was very difficult, because for her it's like she abandoned her team. And she started to ask herself, if I'm not able to going back to work, if I can't be a doctor anymore, what I can do.
Geneviève watched the sister she knew and loved fade away.
It was not her. Like, she just changed. And
you didn't recognize her?
No, she was not able to think logically. She was just afraid of everything.
Karine, a fun-loving 35-year-old, attempted suicide in October 2020. Her family took turns watching her at home. But a supportive, loving household wasn't enough. Karine took her life in early 2021.
She was my motto. So I want to be there for her. And the only thing I want her to know is that I love her. And I'm not there for judging her. I'm just there for loving her. And I'm happy that I shared that to her, because she always be the strongest person I know in my life. And it was very difficult to feel that.
Karin's death was a devastating blow to Canada's healthcare community. But even before the pandemic, a 2019 survey showed that 86% of ER doctors in Canada were burning out, and 6% had thought about suicide the year before. COVID-19 has only magnified the problem. In Quebec, one of the provinces hardest hit by COVID, Professor Jason Harley is watching the burnout rates of healthcare workers closely. Harley's team at Montreal's McGill University surveyed doctors and nurses during the first wave.
We found a statistically significant increase in levels of burnout, anxiety, depression, and stress.
So does that mean people just can't get back on their feet, or they're working on their feet, ignoring what else is going on with them?
It's been a psychological marathon for them. Healthcare professionals are there because they want to help people. And so there's, I think, also a tremendous amount of pressure on them to keep themselves going and to be at 110% every day.
But according to the McGill University Health Center survey, the resilience of healthcare workers is eroding fast.
We found that 50% of nurses and about 20% of physicians were seriously considering quitting their jobs.
Half the nurses that responded to you said they might give up. Wow.
Amy Varley and Sarah Fung have been pushed to their limits. They're both registered nurses in Ontario. They host a weekly show called The Gritty Nurse Podcast.
Test. Check, check.
They started it after their own job-related struggles with mental health.
Why does this keep happening in nursing?
To talk about what most healthcare professionals don't want to say out loud.
You started this podcast to break a culture of silence.
Yeah.
What does that mean, Amy?
For me, it's so hugely important not to be silent. I need to let others be able to see that it's okay to not be okay. And it doesn't make you weak to say, I have mental health struggles or I have mental health challenges.
What is it like being a nurse right now in the pandemic?
The last year has been really exhausting. It's been traumatizing. It's been taxing on nurses.
You use the word traumatizing. Do you feel that there's trauma after this year?
I think most nurses, if you talk to them, are suffering from some kind of post-traumatic stress disorder. Like, I was talking to a nurse recently who said that in the last 2 months, she's seen more death than she has in the last 10 years of her career. So this is not an exaggeration to say that many nurses are traumatized and continue to be traumatized by this pandemic.
The Gritty Nurses also reported on the suicide of Ontario nurse Stephanie Van Wyn. Stephanie's family has not spoken about the circumstances of her death, but the Gritty Nurses say her loss speaks to a problematic culture in nursing.
I think this really rocked the nursing community because for the first time it was like, yes, this is tangible. This is what we've been saying all along. And now this really young nurse has taken her life. And more recently, there was another nurse who took her life. These are really the canaries in the coal mine that we are crying out for help, and we don't feel like anyone is helping us.
To ensure nurses can mentally push through this pandemic, Amy and Sarah are advocating for universal paid sick days.
It just speaks to the work culture and what you are getting yourself into.
Especially for nurses that are part-time or on contract.
If you give nurses the adequate amount of time they need to recover, whether it's physically or mentally, they can come back to work ready to work and healthy. Whereas if they just stick it out and work while they're sick, they may end up exacerbating whatever issue they have.
They also say nurses on the front lines need more money for mental health services now.
Some organizations have as little as $200. That's not going to get you anywhere. Starbucks Canada is giving their employees, even their part-time employees, up to $5,000 for mental health benefits. We work in hospitals. Why is there so much variation? We just need to do the right thing. Like, mental health is healthcare.
While some advocate for services, others have lost hope in this pandemic. On January 8th, 2021, the Dion family said their final goodbyes to their beloved Karin. Now, her husband David and son Jacob are doing their best to soldier on. David, too emotional to do an interview on camera, let Karin's sisters speak on his behalf.
Her husband, he tried to do his best for his son to continue to live because it's what she wants.
Yeah, it's like living life for her.
Exactly.
In a way. Do you think, Geneviève, that there's anything that could have saved Karin?
The situation is very complex. The stress was so high. we can't change that, like it's what's happened. And I think because she had a so big heart, it's also what's killed her.
Coming up.
I was literally like a walking ball of anxiety.
Reaching the end of endurance.
It feels almost shameful to not be able to handle the pressure.
When W5 continues.
So, just checking at the end of a pretty long night shift. Lots of really sick patients, some quite a bit sicker than I'm used to seeing recently. It's about 2 a.m. and I'm happy to be done.
Shazma Mithani is an emergency room doctor in Edmonton, Alberta. Since we can't go into the hospital, she recorded a few video diaries of what life is like in her ER during COVID.
This shift in particular was pretty mentally challenging to kind of stay on top of things while being tired.
After another day of unrelenting COVID cases, Dr. Mithani has finally finished her shift, but her day is hardly over.
Probably go home and sleep for maybe 2 or 3 hours, and then I have an entire day packed with meetings after this, so I guess I'll sleep later tonight.
Doctor, do you feel like you're burnt out right now?
Absolutely. Just physically, emotionally, mentally. I think myself and a lot of my colleagues are burnt out right now. At the beginning of the pandemic, when things were very uncertain, it almost felt like we were going to war, like that we were putting ourselves out there to care for our patients, but at the same time putting ourselves at risk. Once the second wave became very challenging at work with the onslaught of patients that we saw, shifts became way harder. The cases we were seeing became much more emotionally demanding. When I have a tough case, it's hard to even hold back the tears at work. I have to kind of just go to the back room and take a moment just to breathe.
Dr. Mithani splits her shifts between 2 hospitals. She's also an outspoken health advocate in her community. That's on top of having 2 kids under the age of 6.
How are you getting so high? What's it like being a mom and a doctor at this time?
It's challenging. The priority feels like it always has to be your patients, because you want to be on. You want to be 100% on for your shifts, and if that means that that's the only energy that you have to give is to work into your shifts, then everything else around you starts to suffer. Spending an hour with my toddler son when he's being particularly challenging, as toddlers are, like those sorts of things even like just bring me to tears, because I just can't find the strength in that moment to have the patience that I need to for my own family.
Dr. Mithani has relied on a provincial psychological hotline for those on the front lines. The Alberta Medical Association says calls related to anxiety, stress, and depression are up 25%.
Do you feel, though, that the culture in healthcare can sometimes be like you folks have to be the superheroes?
Absolutely. It feels almost shameful, right? To not be able to handle the stress, to handle the pressure.
Mithani says that pressure is compounded by poor policy. During the second wave, Alberta had some of the highest case numbers in the country, but was one of the last provinces to introduce tougher restrictions.
I feel the right thing to do was to shift things to protect the healthcare system. And unfortunately, what that means is increasing restrictions and putting in stronger measures.
What would you say to those people, doctor, who are frustrated with the restrictions?
I would say, I understand. I'm frustrated too. I just want to get back to normal as well. But at the same time, I mean, I almost wish that I could show them a glimpse of what I see.
We need to do our part, and that part is following public health safety guidelines. That's what we can do to contribute to reducing stress for our healthcare providers.
Jason Harley, a McGill professor who's training future doctors to handle stress better, says psychological supports should be prioritized as lifelines during this time.
And so this is where it's important to talk to someone in counseling, to have an opportunity to participate in different types of activities, art therapy or whatever it is. There's different things for different people, which is important. But it's also important to destigmatize those services so that people really feel welcome and encouraged to take them up.
But Harley's research shows that even though the majority of healthcare workers are well aware of counseling supports, roughly 10% actually use them. LaToya Megan doesn't know how she would have coped without counseling. While some personal support workers walked off the job in Quebec, she stayed. 2 out of every 3 COVID deaths in Canada have been at long-term care facilities like hers. LaToya says the first wave was the worst.
I was literally like a walking ball of anxiety. To leave the house, like I had palpitations. It was just like my mind, it was very hard for me to deal with.
So it's like your mind is running 24/7.
24/7, constantly like just worry. What letter is this?
LaToya tried to shield her 3-year-old daughter from those feelings, but her fear only intensified once COVID entered her workplace.
Good job. The virus came inside the building, and then there was no control, right? And there was no discrimination. So one by one, seeing my colleagues being affected, seeing the residents turn out positive and just deteriorate in front of my eyes, it was very hard to see.
That made going to work a daily struggle. But the 11-year personal care worker powered through because she loved her residents. Then she got COVID.
Your worst fear came true. What are you thinking?
I thought I was gonna die. I honestly didn't know what to think. Yeah, mommy's gonna be sad. Sister doesn't want to give mommy a kiss.
When you think back to that time, LaToya, how were you able to be a mom?
It was heartbreaking. I was physically exhausted all the time, and I constantly was terrified of giving her the virus. She wanted me to give her a hug and a kiss, and I'm telling her, no, I can't, mommy can't pick you up, like, and she didn't understand, and it was just so hard.
Even after she recovered from COVID, LaToya was still fearful. In June 2020, she was diagnosed with major depression disorder and anxiety. She's had to reduce her work week from 5 days to just 3.
Did you ever have any anxiety or depression issues before?
Never. Sometimes it's still hard to believe how much it's affected me because I have coworkers who've gotten sick as well and who are back to work. And that also plays a toll on me because it makes me feel weak.
It's a stigma many healthcare workers face. Friends have encouraged LaToya to quit her job, but she can't bring herself to do it.
They don't understand what it's like to have nobody. If everybody thought like that, then the residents would die in their beds because nobody would be there to take care of them. So I couldn't. As much as I wanted to, it's like, I just couldn't. It's not in me to abandon people.
Despite all she's been through, LaToya considers herself lucky. While PSWs in many parts of the country have been petitioning for full-time hours and permanent wage increases, LaToya's workplace has offered her reduced hours, sick pay, and access to a therapist. But living with anxiety is a daily struggle.
LaToya, what is your biggest fear?
My biggest fear is I'm not gonna get back to normal.
A frightening thought for many on the front lines.
When we're looking at something that's gone on for so long, as it is now, there aren't any magic fixes. There's not a silver bullet that we can throw at the situation.
Reza Isagian has a few tips for healthcare workers after pushing through traumatic circumstances himself. He's worked with Doctors Without Borders in some of the world's deadliest places. Reza says the stressors of COVID have similarities to war zones.
Not only are you concerned about your inability to treat everyone to the same level that you would have if you weren't overwhelmed, but you also have to take care of your own safety. And in this COVID pandemic, that is certainly a big part of this.
What would be your advice to healthcare workers on the front lines right now that are in the trenches?
You have to remind yourself that you're still this human that has these basic human needs. You're not able to constantly see suffering and respond to it perpetually and continue to do the things that bring you joy. But I think also to process it. That's a big part of of managing this situation is processing what you've seen, really understanding what it is that you saw and how it made you feel.
How did seeing a counselor help you?
It's an opportunity to speak about what you saw and what's going on with you. And you shouldn't just bottle it up and hide away from it. Maybe at that moment you have to move forward because you're in an emergency, but you need to give yourself time to reflect on what you just saw and really grieve for the sadness that you witnessed.
How do you, even when it's tough, stay motivated?
When this pandemic ends, how you were part of it are actually things that you will cherish and look back at, that you were part of that and able to respond.
Practical advice that could save lives, especially as parts of Canada battle a third wave of this virus. More sick patients and more death means more work for healthcare professionals. Edmonton emergency room doctor Shazma Mathani is worried about what's around the corner.
Now we are in a situation where there are these new variants of concern, and I can tell you from a healthcare worker perspective, we are just so near the end of our ropes that a third wave might be enough to break us.
If you or someone you know is struggling, go to our website, w5.ctvnews.ca, for a list of resources.